Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to recognize and treat an eye injuries. Eye injuries can occur due to many causes, including accidents, flying debris, falls, or vehicle collisions, chemicals, or radiation. The definition for the type of injury may involve the part of the eye involved. A corneal injury, for example, affects the corneathe transparent dome over the colored portion of the eye. /r/n/r/n eye injuries can involve bruises, punctures, burns, and scratches. Even if they don't seem severe, any of these can be very painful and some can cause permanent vision loss. This article discusses eye injuries, the damage they can cause, and how to prevent them or minimize damage. /r/n/r/nAndreyPopov, Getty Imagesrnrn While some types of eye injuries are rare flukes, the 7 types below are the most common. /r/n/r/n A black eye is a bruise that occurs around the eye, usually with some swelling. The source of the black eye is often a blow to the area, whether caused by an altercation, fall, or impact by a hard object. Within a few weeks, this usually goes away on its own. /r/n/r/n A blow to the area of the eye can cause bleeding under the skin and a black eye. It may also lead to swelling in the area, particularly of the lid, which can create pressure on the eye and cause damage. Blunt trauma may also cause bleeding in the eye, hyphema. /r/n/r/n Even if the eye itself is not directly injured, if you have a skull fracture, this can cause bruising around the eyes. /r/n/r/n Burns to the eyes can result from chemicals, heat, and high-intensity light. /r/n/r/n Many things can cause a chemical burn. If flushed out quickly and thoroughly enough, they may not cause permanent damage to the eye. However, with some substances, such as bleach, oven cleaner, or battery acid, it may take a day or so to determine how extensive the damage is to the eye. /r/n/r/n Hot air or steam blasts to the face can also cause eye burns. If you don't wear light-filtering sunglasses, bright light from a sunlamp or that reflects off water or snow can burn the eyes and even cause temporary blindness. /r/n/r/n Be sure to watch for signs of infection, such as pain and decreased vision, with any eye burn. /r/n/r/n Also known as corneal abrasions, painful eye scratches can occur when there's a tear to the clear outer layer if something rubs or tears this tissue off. This can often heal on its own in a couple of days. /r/n/r/n All kinds of foreign bodies can get in the eye, from a speck of sand or eyelash to flying debris, such as a shard of glass that can land on the surface and even become embedded. In some cases, this is something you can easily flush out on your own. But in others, it requires immediate medical attention. /r/n/r/n In penetrating eye injuries, something penetrates the eye but does not work through to the other side, there is no exit wound. If there is also an exit wound, it is a perforating injury. /r/n/r/n If you have an open globe eye injury, you have a wound that goes through the eye wall. It can be due to a laceration by a sharp object or projectile, or blunt trauma, where there's a blow to the eye that ruptures the globe. /r/n/r/n With a closed globe injury, parts of the eye may have issues, but without a full-thickness wound to the eyewall. Examples include partial-thickness corneal abrasions. /r/n/r/n After an accident involving the eye, here are some things to look for. /r/n/r/n It can be surprising how painful an injury to the eye can be. That's because of the number of nerves present in the eyes. In particular, the clear cornea is one of the most densely packed areas for nerves in the human body. So, even if you just get a nick here, you may be in a lot of pain. /r/n/r/n While an eye injury can happen anywhere, you may be particularly vulnerable under certain circumstances. /r/n/r/n. Many sports involve some degree of risk for eye injuries. Common sports-related injuries include /r/n/r/n. While some occupations are riskier than others, eye injuries at work are all too common. About 20,000 eye injuries occur at work each year in the United States. In some cases, this may involve nothing more than eye strain, but in others, you may have to contend with the following: /r/n/r/n. Even at home, you're not necessarily safe from eye injuries. From cleaning the house to working in the yard or undertaking a home improvement project, you may face an eye injury. This can come from things such as these: /r/n/r/n. Accidents can also lead to eye injuries, whether from a fall or some type of collision. Anyone can have a fall, but older people are particularly vulnerable. The most common eye injuries from falls include fractures of the orbit, the bones that surround the eye, or to the eye socket bone, as well as black eyes, eyelid damage, and tear gland issues. /r/n/r/n. Also, if you're involved in a collision, such as a car accident, you may incur an eye injury. Common eye injuries from car collisions include corneal injuries, subconjunctival hemorrhages, broken blood vessels in the eye, bone fractures, and eyelid issues. In most cases, there is no change in vision. /r/n/r/n. Eye injuries can also occur while at play. In fact, it is during entertainment and sports activities that almost 50% of eye injuries happen. Things that can cause eye damage here include /r/n/r/n. The parts of the eye that are often hurt include the bones around the eye, the lids, and the tear drainage system. /r/n/r/n. Unfortunately, violence is another way that eye injuries can occur. Those who are survivors of domestic assault often suffer from orbital fractures, cuts on the eyelid and around the eye, and other injuries to the eye. /r/n/r/n. In most cases, children who suffer from eye trauma experience accidents, but sometimes violence is the source. For children, retinal hemorrhages from being shaken are the most common ocular injury for those with abusive head trauma. /r/n/r/n. You can expect to undergo a full eye exam if you have an eye injury. In addition to a standard eye exam, the eye doctor, ophthalmologist or optometrist, will also examine your eyes with the slit lamp, which after dilating, widening, your pupils. This allows them to look at the structures inside your eyes for any damage. /r/n/r/n. During such an exam, it's common to use fluorescein dye to make it easier to detect injuries. /r/n/r/n. Every eye injury should be taken seriously. You may be able to use first aid for minor issues before seeing a healthcare provider. /r/n/r/n. Some tips for handling minor eye injuries to consider are: /r/n/r/n. You should be sure to contact a health provider for an eye injury if /r/n/r/n. It is best to avoid experiencing an eye injury in the first place. /r/n/r/n. Even when you're in a familiar environment, such as home or work, accidents can happen. To avoid this, keep the following in mind: /r/n/r/n. Using protective eyewear can be your best line of defense. Be sure to wear protective eyewear whenever you are. /r/n/r/n. Sports can be a lot of fun but can also put you at risk for eye injury. The following sports, in particular, may put you at higher risk. /r/n/r/n. To avoid sports injuries when engaging in any of these activities, wear protective eyewear specifically for the sports in question that meets standards for Canadian Standards Association, CSA, racket sports or the American Society of Testing and Materials. /r/n/r/n. An eye injury can occur almost anywhere and can include everything from blunt eye trauma to foreign body injuries. It can occur for myriad reasons, such as while at work, play, or home, by accident, or sometimes intentionally. Keeping injuries in mind and taking preventative measures can help preserve your vision. /r/n/r/n. rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.